Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. All right, Gloria, tell me what's going on with your knee. What happened?
Well, I've been having knee pain for almost 3 years now, 4 years. It started when I fell walking and I didn't think about it. But for a couple months later, that's when the pain really started.
You start to have more pain
More.
a few months later. Okay.
So then I went to the doctor, to the orthopedic doctor, and because of the swelling, they said, "Oh, you got fluids in there, so we have to aspirate it."
Aspirate. How many times they did that?
3 or 4 times
Okay.
with the cortisone. And the cortisone.
So you had the cortisone shots with that too?
Yes.
Okay. How many cortisone shots total?
3, 4 times too.
Okay, so 3, 4 time aspiration and cortisone shots. What else?
So they said, well, you have to take anti-inflammatory,
Okay.
and because they aspirate with the needle, I need to have antibiotic. So I got antibiotic with that too, anti-inflammatory, and the cortisone. It didn't do well with my diabetes. So
your blood sugar went skyrocket?
so my blood sugar went high, and of course they have to increase my insulin, and one thing led to another.
Yeah, that's like a train wreck.
Yes.
Sorry about that.
Yes, and finally, after the third, fourth injection, well, I take a vacation because I'm retired early to travel, and I said, well, I have to go. So he said, well, I'll give you another injection and you're on your way to Spain. I said, okay. So I was in Spain for like 3 weeks, and 2 days before that, before the tour is over, I can't walk. And I came back with a wheelchair from the airport. So then I went to his office and he said, oh, well, you definitely need surgery now.
Okay, so what type of surgery?
So he said, we're going to do a partial, and I thought...
So you had a partial knee replacement, and we're going to fast forward like with the type of surgery you had.
So, partial knee replacement, I did that for a year, went for physical therapy, and nothing happens. My range of motion is still bad. They give me the adjust brace to bend my knee.
Yeah.
Didn't work. So they said, well, it's still swelling, so we have to draw blood again. I'm like, what?
Aspiration again. Okay.
So I said, what am I supposed to do? He said, well, you're diabetic, your healing process is slow, so it might take another year. So after that, I said, no, I'm going to go seek another opinion. And so I went to this other orthopedic surgeon. He says, oh, that thing is no good, we have to replace it. And
so now you had partial knee replacement, and then you had a total knee replacement.
Exactly.
So 2 surgeries, several aspiration with the cortisone shots. What else happened? What happened after that?
then after the second surgery, my range of motion is still not there. I still cannot bend more than 90 degrees.
Okay.
It's been months, so he decided he has to do a manipulation. I said,
Under anesthesia?
Under anesthesia.
So that's the third surgery.
So then he said, well, okay, go for physical therapy. So I went for physical therapy again, give me more pain medicine, and...
Your blood sugar went up more?
Yes. And then he said, well, there's one more that we can do. We can do a cleanup.
Orthoscopic.
Arthroscopic. Plus, if I'm there, I'm going to do a manual manipulation again.
Another manipulation. So the fourth surgery, the first one, orthoscopic with manipulation. Okay.
Then finally I said, what am I having? Am I having arthropibrosis here now?
So what did he say after the fourth surgery?
He said, well, we have to wait because, you know, you have went through this.
It's your fault. I'm sorry. It's always blame it on the patient. It's the patient's fault.
Yeah.
So after the fourth surgery, have you felt any difference, or you've been feeling the
No,
same?
not really, Dr.
Okay.
Jacobs. Well, I should say, I'm disappointed, but I'm a person that would seek more things that I could do instead of sitting in one corner.
Yeah.
Of course,
Don't give up. You know,
I can't
we're
deny
gonna
it.
work on it.
I can't
Yeah.
deny that I had some depression in between. And my
Well,
blood
for
sugar,
almost 4 years, you
Yeah.
had a lot of
Yes.
surgeries. You're not
Yes.
able to do the stuff you like
Yes.
to do. So let's go over what is difficult for you to do now.
Well, I can't travel. number one. Walking,
Standing, sitting.
going up on the stairs,
Okay.
sitting down, getting out of bed in the morning. It's the worst thing,
Mhm.
and that pain is constant.
And you can see the swelling here and the knee compared to the other knee. It's really. So, how much pain do you feel there from 0 to 10? 10 is emergency room.
Hey,
Is that 8 constant or comes and goes?
oh yes, it's constant.
So constant 8 out of 10. What kind of pain? Dull, sharp, aching, and where do you feel it exactly?
It's an aching pain. It's all anterior, lateral, front, you know,
Okay.
and all over here. It's really painful and also tender.
Okay. So she's a nurse. That's why she's anterior. So
Yeah.
it's the front and the outside
Yes.
and the inside
Yes.
of the knee. And how much it goes up when you experience severe pain?
Well,
From 0 to 10.
it could go up to 9 to 10
Okay. And what make it worse?
when I get up in the morning.
Okay.
That's the worst thing because when you
It's
sleep
more
at night,
stiff.
yeah.
And you, of course, you had physical therapy. You had massage. What else you had?
Well, of course, the pain medication.
Okay. So you had everything in the book.
Yes.
Okay. So let's have you actually walk,
Okay.
and we're gonna walk this way.
Which way?
This way.
This way.
Just a few steps. How much pain from 0 to 10? So you've been walking like this for the last almost 4 years?
Yes.
Sorry about that.
9.
Okay, let's come back. You wanna rest a little bit?
Hold on. I tend to do this way here because
Where do you feel the pain?
front, the whole front.
The whole front. So it's been 8 out of 10 for the last almost 4
Yeah.
years, yeah? Okay. So we'll have you lie on your back. I'm gonna measure your range of motion and we'll start the treatment, okay?
Sounds good. Thank you. Right. Yeah, there's a little bit of a difference when I'm with that, with the magnet.
What's the difference? Let's go back and forth.
The
walk and
ease of bending my knees is a lot.
You see it? She was using the cane before. Yeah. How's that?
Very good.
You could not even do quarter of this distance.
No, I mean I get so tired quickly,
What
and the
about now?
pain and the pain is really limiting me, and the movement and the stiffness is really giving me that.
We're gonna walk back and forth. Make sure it's pain for you, okay? How does that feel? Do you feel any pain now, or it's no pain?
No,
No pain? Okay.
no,
With the
the-
magnet, no pain?
no.
Okay.
The tightness is still there, but I could, you know.
Well, it's gonna take a while to the tightness because you have really severe swelling. That's gonna take a little bit time with the supplements and the magnet heal because it's very swelled up. What I care about is your pain because if you don't have pain, you're moving around, you're functioning.
Oh yeah, when,
That's
look
what I
at there
care
when
about.
I'm in their house.
Yeah.
I was like, now, oh my God.
Now you. Yeah.
How come I didn't see you right away?
Well, now you know.
I mean, you're the answer to my trouble right now.
Well, I'm glad you were able to come from Chicago here.
I mean, I never stop looking for some solution.
Don't give up.
And,
There's a solution always.
And before I even went to an orthopedic, they were delayed for 2 weeks, and most probably he said, I'm going to do surgery on you. Most probably I did one for surgery already.
Oh.
But then I found you.
Okay, don't tell him that you found me, okay? He will not be happy that not doing another surgery.
And then I'm like, I just gotta get in touch with you.
See how many times you went back and forth?
My brain is just like saying, I'm just
With
gonna
no cane.
I'm just gonna get in touch with you, and I don't know what other people has to say, but it's my body, and I have to try something different, and it's
Yeah.
unconventional.
Mhm.
I know how physical therapy would say, Gloria, we need to do this thing to you, and I'm like, okay. I keep saying okay, but I'm not getting better.
What that mean? Do you remember the definition of insanity? Doing the same thing over and over, expecting different outcome.
Yep.
Yep.
Well, it's like you're doing research and you do the same way, so nothing happens.
Are you trying to show up now?
Well,
Sort of.
You walked 2 miles so far, okay?
no, I'm a walker. I'm a walker. I like to walk.
What do you think about ASTR treatment? So to tell patient had total knee or any injury, you are a nurse,
Yes.
and you had 4 surgeries failed. You had injections, 3 injections, and cortisone injection. You had a lot of pain medication. So what do you think about ASTR treatment? What we used for like just a few minutes.
ASTR treatment is something that you guys has to come here. Never delayed anything, because for me, I can't believe it. Just when somebody will tell me that it would be like this, I won't believe it. But I'm here now. So if I'm here now and I'm feeling it,
Yeah.
this is the
I'm glad
guide.
you're feeling better.
This is the guide.
Yeah, good. Awesome. Thank you.
Oh, thank you, Dr. Jacobs.
Yeah, we're glad you're feeling better.
I'm a little emotional.
That's good. Well, you're doing great now. You ready to run a marathon?
Oh, yeah.
Yeah.
Come on, let's go shopping.
Yeah, well,
I got my knee back.
that sounds good, except the money part of shopping. That's good. I'm glad
Yeah.
you're feeling better. Yeah.
Look at that.
Well, it's standing on 1 foot. You see that?
Look at that.
You're really trying to show off here. That's good.
Oh,
Yeah.
my.
That's look good. You're really doing great.
3 to 4 years of suffering, and I got this for just a few
Minutes.
minutes. How did that happen?
Well, there's really a lot of studies support this, and there's science behind it. So it's working on the root cause of the problem. So I'm using the MagnaHeal to decrease inflammation. There's a lot of scar tissue, a lot of fascia restrictions. If we don't release it, you're basically not treating patient with after surgery, and you visually can see the swelling. You visually can see and feel the scar tissue. Stretches is not going to break the scar tissue. It's not going to decrease the inflammation.
Yeah, because that's what I was told.
Actually, stretches will cause more inflammation based on the studies. So it's really, some treatment actually make things worse. When they start to study those grandfather treatment that been used for years, they were realizing it's not actually getting people better. Actually, some of them make them worse. But I'm glad you're feeling better. Yeah, awesome.
Oh, Dr. Jacobs.
Yeah, that's good.
You changed my life just for a few minutes.
Yeah, thank you. Thank you. It's awesome. We're glad you're here.
See, you just have to.
Be persistent.
Yeah.
Don't give up.
Yeah.
That's all.
Yeah, that's what I
Yeah,
did. That's
yeah.
what I did.
That's what I did after my cancer treatment, because I had 6 doctors misdiagnose me and give me an effective treatment. I almost lost my life 3 times.
Wow.
If I gave up, I'm not here today.
There you go.
You know? So don't give up.
Now you treated me,
Yeah.
and
yeah.
I thank you for that.
Yeah, thank you.
Yeah.
Thank you. Awesome. All right, Gloria. So today is your second ASTR treatment. Can you give me update how you feel?
Well, Dr. Jacobs, it's a wonderful second day again. And I can't ask for more. You definitely give me the best that I have with my life that I'm praying for. And no matter what, I made the right decision. I forgot to walk already.
Because the 3 years of
Because
chronic
of the
pain,
3 years, and instead of looking up, I'm looking down. I'm always limping. Now you discovered that, you know, I can do this in just a matter of few minutes, and you're teaching me all the tools that I can use at home. I would ask everybody to just come down here.
Yeah, come here.
It is a wonderful experience.
Yeah. So you were saying before you had...
and a life changing to me, because not having to do the things that you like to do, because I like to travel and I like to walk, and when you lost that, that is a lot to deal with.
It's depression.
And
Depressing.
I could lose my mind already, but I never stopped looking. And
Don't give up.
And I found you.
Yeah, I'm glad to work with you.
Thank
It's
you
an
very
honor.
much.
Yeah. So you were saying before I start treating you that you had constant 8 out of 10 pain, and if you watch the first video, she was actually using the cane, not even passing the first door here from the pain. So can you tell me now, how do you feel pain-wise? Walking?
The pain is so down that I can hardly say that I am a 3. When you're coming out from the 8 and 9,
That's constant, yeah.
For a day, that is like magic. And you know, if you will just tell me that, I'm not going to believe that. But
Okay.
I'm here and I'm experiencing everything.
The proof in the pudding. So we have the video for you before when you had the pain, the way you're walking.
Exactly.
So now we're gonna have you walk.
Of course.
After we worked on it.
Come on,
And this is a second treatment.
I'm gonna show the world.
Yeah, you'll have you walk.
So should I walk?
Just walk back and forth your normal speed, your normal self.
Just walk back.
Yep. I just put a little bit heel left there, as you see, just because she had like minor like ligament discrepancy, but if you compare this to really, we can have you walk back and forth, so I'm just gonna
Hold on.
explain a couple of things. Compare between the gait, the speed is like significantly faster. Of course she's not using a cane. Yesterday when you left, it was funny when I saw you holding the cane on your side like this.
Yeah, that was that well, you know, like this is a dream now.
Yeah.
that I can do this, and having just to think that, you know, there's some wonderful things out there, and you just have to be persistent in finding the solution instead of
Don't
looking
give
at
up.
just the problem. Then here I am. So people should not really be thinking more of the negative, but you have to focus on the negative. So because there's somebody out there that can help, and that's you.
Yeah, thank you. So what do you think about ASTR treatment? 2 sessions.
Perfect.
Yeah, you had PT, 4 surgeries.
Perfect.
Awesome. Thank you so much. We're
Thank
glad
you.
to work with you.
Thank you so much, Dr. Jacobs.
Thank you. Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen.